My name's Ali and I'm one of the nurses at Te Pūrorohu.
And I'm Colette Muir, I'm a developmental paediatrician.
We see children who have experienced abuse or neglect and have either been uplifted into state care or at risk of being uplifted by statutory child protection services. We complete comprehensive health and educational assessments on these children to identify any unmet needs. We noticed that really large numbers of children were not being brought to their gateway appointments. We also noticed that many of these children were unimmunised and remained unimmunised despite coming into the gateway clinic.
So we really looked at 3 new processes to address these particular areas. For the first, the attendance at Gateway Clinic, we initially found that only 60% of children were attending their appointment. Put a number of different strategies in place, including negotiating the time for the appointment, assuring transport was arranged, seeing large families on the same day, and making sure that even if children came on the wrong day, that we saw them anyway. We increased the visibility of the Gateway system within our organisation, so other services were able to contact us to get social worker details to ensure families attended, and also let us know if they didn't attend so we could problem solve for future appointments. With regards to the immunisations, we ensured we had consent where possible from families before the child came to the appointments and were immunised on the day of the appointment.
And we found that attendance went from about 60% to 95% at gateway appointments, which we were really pleased about. We also found that the attendance at subsequent medical specialty appointments improved from about 55% to 100%. With immunisations, previously we had about an 88% failure rate, and we managed to reduce this failure rate down to about 14%.
So in conclusion, we found that taking a quality improvement approach helped us to identify and improve the health for these very vulnerable children. We found that developing relationships with other services really assisted with improving these rates and improving the health outcomes for these children.